Good morning, everyone. I'm Chad Koulis, Executive Director of the Midway Chamber of Commerce. Thank you so much for joining us today. We're going to learn a little bit about HR from Sime and also from Mike Schiebel from Deneen Pottery. I'll just do a couple of quick announcements. Tomorrow we have our final event for our celebration of nonprofits. It's on fiscal sponsorships, and that's also at 8 o'clock tomorrow morning. And then our last event of 2020 is our virtual holiday party, which we're going to have Thursday at 4 o'clock. And if you go on there, you can learn how to make beer cocktails from Urban Growler and also some fun holiday cocktails from, oh my gosh, I just all of a sudden forgot their name for a second here. Our distillery. Oh my God. I can't think of their name for a second here, but Shelly from Studio Distilling is going to be on. And they're going to be showing us how to make some fun cocktail recipes for the holidays as well. You can wear an ugly sweater, you can make a gingerbread house. It's going to be a fun time, and I hope you can make it. And now I'm going to introduce Sime. Kara is an HR consultant and coach with over 20 years of experience working in global organizations in a variety of industries and business models, including manufacturing, engineering, food, Fortune 500, family business, private equity, North American co-op. This variety of experience has made her technically sound HR professional in a variety of settings and has given her strong strategic business skills to help companies and leaders make HR work for the business. She's a coach to HR professionals and also provides HR technical assistance and strategic guidance to business leaders. Please welcome Sime.
Thank you so much, Chad. Thank you, members of the Chamber and general public and business owners or HR folks. We're happy to have any or all of you here today. So happy to have Mike Schiebel with us as well. He's going to tell us some real life stories at his Chamber member company. And here we go. So our agenda today is pretty comprehensive. I hope it gives you everything you need. We're going to do a quick review of the FFCRA, specifically the EFMLA and EPSL, which I'll explain in a moment. Your employer obligations if an employee does test positive or is exposed to COVID-19. Options for your business response and some specific things to consider around safety or health and wellness and work comp. Then we'll talk to Mike in depth, and then we'll have your business input and learn how others are living with COVID and what your business response is already or is going to be because of today's session. And then of course we'll take questions. So the FFCRA, the Family First Coronavirus Act, passed in a hurry back in March of this past spring, provided an emergency FMLA and an emergency paid sick leave to employees. Probably by now, most of you at least have heard of this or know a bit about it. I know there's a lot of details on these slides, and by no means do I expect you to memorize them or know them all. Just know that this regulation excludes healthcare workers and emergency responders, but it includes all employers under 500 employees, plus the government. The EFMLA will apply to anyone who's been employed for 30 days, unlike regular family medical leave. That is for employees who've been employed a year. This one kicks in much, much sooner, but is only used for a closed school or daycare, or if someone's unable to telework because of the closed school or daycare. It will provide leave for a 12-week period, and the first 2 weeks would typically be paid under the emergency paid sick leave or PTO. And then the following 10 weeks are paid under this leave at 2/3 their regular rate of pay, but to a maximum of $200 a day. There's an employer tax credit for this leave of absence along with the emergency paid sick leave. So there's some rules around this I'll talk about in just a minute. And employees can use the emergency FMLA intermittently. The emergency paid sick leave is, again, same general criteria, but you get 80, or employees will get 80 hours of paid sick leave when a quarantine is ordered, when it's for themselves or for a dependent family member, or if they have any symptoms, or for their closed school or daycare. So they would use this the first 2 weeks of that emergency FMLA if they needed it. We can't require as an employer that they use any sick time or PTO first. And on this one, if there sick themselves, they get a much higher daily per day rate or max of $511 with a 10-week total max of 5,110. You pay though, you don't pay that max unless it's appropriate. You pay 2/3 of their pay up to those maxes for the ill dependent or other. And then if someone is a dependent or another person you're taking care of, you're going to pay a lesser amount. You pay more for the self that gets ill, the employee that gets ill versus them caring for someone else. Again, tax credit here. So you get the money back from the government through the payroll tax process. There is a posting requirement. I just want to remind people, and if you put the poster up at work, but most people are teleworking, you do need to send it to remote workers. Make sure everyone is aware of their rights under the FFCRA. If an employee is furloughed or laid off, then they're not eligible for these leaves if they get sick. And don't forget to include shift differential and leave pay in your pay calculation. And little known, there is a small employer exemption to this law. You could get around it, but it has extremely narrow reasons and really will hinge on if the business is threatened to go out of business if they were to pay this funding. So it is very little used. And FYI, this started on April 1st, but it's expected to expire on December 31st. That's a really important date. This leave will no longer be offered at that point, and I've heard nothing in the various stimulus discussions about re-upping this particular type of stimulus or this particular type of protection for employees. So just be aware of that and watch the news as we get closer to the end of the year.
Hey, Kara, can I ask a question?
Yeah.
With these rules, is it specifically for employees that can only do their job on site? So many people can work from home now. Is it a different scenario for that?
That's a great question. And it's definitely for, of course, people who can only be on site and need to miss work. But it actually could apply to people who can work from home if they can't work from home. If the duties of caring for someone or their own illness is so severe that they can't work, they are eligible for this leave as well. So the employer obligations. If someone tests positive or is exposed, by now we all know the word quarantine, and we know that that's supposed to mean stay home, but it really, really needs to be stay home, not stay home from work and run errands, which I know can happen at some point. So the days you need to stay home have changed slightly recently from the CDC, but in general, we've got kind of 7, 10, and 14 days. And the 7 days, I know for people eager to get back to work, is the best if you can have a negative test result. If you've been exposed to someone and you go get a negative test result after 5 days to allow the incubation of the disease to progress, and you have a negative, you may come back to work after 7 days. Ideally, and in the state of Minnesota guidelines, they're still saying you're going to stay home 14 days if you have a positive test, if you're exposed to someone, but 10 days is typical, and the guidance if you have a positive test and you meet a variety of criteria and your symptoms are getting better and you're fever-free for over 24 hours without medications, etc. All that information is available on the Minnesota or CDC website, but those are the general guidelines. And obviously a negative test result is very helpful. However, if they're staying at home and quarantined, they can work from home. So therefore, to your point, Chad, or that question, they may not need the emergency FMLA, they may not need the emergency paid sick leave, because if they're able to work, their symptoms are not severe, they have no symptoms at all, you can continue to pay them and expect work product as you normally would if that's available. However, don't forget, you need to provide the employee with an FFCRA policy as well as a form for them to fill out and request. Similar to applying for an FMLA leave of absence, you want them to request this leave. What are the dates they need it for? Do they want to use PTO or do they need to use it intermittently? All that information should be documented because you're going to need that for the tax credit, especially if you're ever audited later by the IRS. Make sure you're also coding this time properly, like setting it aside in your payroll system and coding it as EPSL or EFMLA so that you can look it up later or report on it and prove that you had this time paid out to employees.
And then Kara, David is asking if this is a law or a guideline.
This, okay, so the FFCRA is a law, and the quarantine kind of, I'll call them rules, are a guideline. They're pretty, I'd say, you know, from a Minnesota perspective and from the employers that I'm working with, these are the guidelines all of them are following. But the mask wearing is a law, for example, from the governor order. These are all guidelines that we highly recommend to prevent the spread of COVID. All employees. So your obligation as an employer, if someone tests positive and has been in your workplace, is for all employees that you then do contact tracing. And the guideline here, it is a guideline, is 6 feet. Has that person been within 6 feet for a cumulative amount throughout a day or a period of 15 minutes? And that period is going to be a 24-hour period. And has that occurred within 48 hours of that person testing positive or showing symptoms and being with that person? So if those things are true, you notify all employees and or customers or just people they've been in contact with. Now, if you have a really busy business like Target and lots of people coming in, you're certainly not going to be able to notify all your customers. But if you're in a smaller business scenario and there's more one-on-one closer contact, if it's possible, you do want to try to notify your customers. And that's why a lot of restaurants, you know, take phone numbers with their reservations now so that later on, if they needed to reach out and contact customers, they could. Don't forget, PHI is protected health information. So when you find out someone has COVID, that is protected health information under HIPAA security and privacy rules. So keep that information confidential. That means don't share their name primarily. You can share there has been a positive result in our workplace or in your work department or area. Ideally, if you can, get the employee to sign a waiver giving you permission to be able to talk about the scenario if you feel it's necessary to do that because of the circumstances. But otherwise, keep that information confidential.
So Kara, I have a question about that, and then we have another question from the audience too. But so I completely understand the confidentiality thing, and you can't share somebody's name, but you know, a lot of people are posting on social media, telling people that they have it, letting maybe customers that they're working with or business contacts, they have it. At what point does that allow the employer to be able to mention that too?
That's such a good question. And it seems as if I should be allowed, right? If someone is posting it all over social media and everyone knows about it or seems to know about it, but legally, technically speaking, I cannot talk about it directly without the permission of that employee.
Okay.
So it's best to be careful. I get it once it is out on social media. If you have employees coming to you and saying, hey, Josephine, I understand is positive. She works with me. Should I be worried? You know, you're probably going to talk about the situation, but you don't have to be the one to ever confirm, yes, it's Josephine or whoever.
Okay. And then Lynn, I'm not sure exactly what part you asked this question. Lynn's question says, what about nonprofits that do not pay taxes? Can we use? Can you clarify, Lynn, what you were asking?
I think I might know because I work with a number of nonprofits.
You did say FFCRA.
And yes, nonprofits also get this tax credit through payroll taxes. So you don't pay business profit taxes, for example, but you are potentially paying employment taxes, Social Security, et cetera, Medicare, state tax, federal tax, that kind of thing on the payroll. And you're going to get that credit back through there. Okay. The training is so important. I'm sure all of you did great training last spring and through the summer. And if you haven't, you've done more probably this fall to remind people about cleaning and safety practices. But I really can't emphasize enough as I work with clients who are having issues or having spikes or problems, the retraining, the constant retraining of people, because people forget. It's kind of human nature. I have a slide on this later for people to want to find efficient ways to cut corners or to do it faster, quicker. and in their minds better, but it isn't always faster and better and more efficient to cut the corners on cleaning and all the safety practices we need to follow right now. So make sure, if you haven't already reviewed those policies, practices, and had employees sign off on those documents like you would an employee handbook, make sure you do that now, or even do re-reviews when you have a big outbreak. And when you have to shut down your plant and everyone has to leave and come back many days later, I think it's worth re-reviewing all of those policies and practices and signing off and having that kept on file. So consider safety broadly, and then we'll get a little specific. There is an executive order that we all have to be wearing face masks indoors and in various settings. You can look those rules up. They've been around long enough. I wasn't going to address those in depth, but I do want to remind people, as employers, you have a general duty clause that OSHA has to provide a safe workplace. Any employer has a duty to keep their employees safe from known hazards, and COVID is a known hazard. And I thought it was interesting, as of November 6th, there's been 179 citations in the US, not just Minnesota, resulting in $2.5 million in fines. That's a lot of places, that's a lot of money, and I was surprised OSHA's been active in getting out and talking to these facilities, so take it seriously. Some other safety requirements, I'm sure most of you hopefully are already doing a lot of extra cleaning of all touch surfaces, clear expectations for staff who stay in the workplace, what their responsibility is for cleaning, for distancing, for the mask wearing. Any other types of sanitary kinds of rules and regulations you want to put into play, you certainly can. Make sure to review those COVID operating plans, those training plans, the cleaning plans with the employee sign off, really critical. In addition, consider the general health and wellness of the workplace. So when you get a positive test result or have someone tell you they've been exposed to someone with COVID, have a handout ready, frankly. Talk to your benefit broker and have a bullet point about medical benefits. What's covered, what's not? What do they need to know? Typically, the health insurance companies can provide some information. You can get that through your benefit broker. It is a huge relief for employees if you are providing them some kind of guidance, again, a memo or a handout. It lists some of these items on the slide. Again, explaining what's available for testing, where are the testing locations near them, where are the free locations, maybe being clear though, if some locations you have to pay to have the test, like for example, in a rapid test, which is handy. We all think we want the 15-minute, 20-minute result, but that does cost money and is not necessarily covered by health insurance. Make sure if you provide an employee assistance program, an EAP, that you provide that information to employees. This is the time that the EAP can be really helpful with the medical side of things and questions, but also just the general stress. We all know that EAPs are great for having some counseling resources available and helping people through financial and just mental health concerns for them or their children. EAPs are generally offered to the entire family. Have this ready and available. I think this says a lot about your culture and your care for the employees. Also consider in your workplace the work comp. If you have a business where you are employing healthcare workers or first responders and they contract COVID, it will very likely, not 100%, but it very likely could be a work comp case. And it's partly because we are a no fault work comp state. So we're not saying the employer is at fault. This is just how we take care of people in these situations. However, other regular office employees, maybe production employees, not frontline workers, it really depends. It could very well be work comp. You may want to submit it and let the work comp carrier work out the details if the employee is claiming they got this at work and that it's the employer should cover things. It really is going to be case by case, fact specific.
Hey, Kara.
Yeah.
What happens if an employee just decides on their own, I don't feel safe at work, I don't think they're doing the proper COVID restrictions? Do they have the right to say, I'm going to work from home instead?
That is a really, I know I just keep saying that. That's a great question. So maybe in typical HR and sometimes legal speak, we say it depends quite a lot. In general, no. If someone has a complaint and feels unsafe at the workplace, yes, they may absolutely refuse to do that job, do that work, put themselves at risk. But I highly recommend that if you need help with this, you can call me too, that you have something in your handbook about this specific event in your safety work comp policies. And what I recommend is that employees can say no, but then they have to be willing to engage and have a dialogue with the employer and how we're going to solve it. Help me problem solve what you feel is unsafe and how we're going to fix it. And so I look at that as, yeah, you may refuse, but you're still going to come to work and probably meet with my health and safety person or the HR person responsible or a safety committee member to now troubleshoot and figure out what we're going to do differently. Hopefully that answers that question. Now, some considerations from a health, wellness of the workplace situation for working from home. Keep in mind, it's not listed here, but when employees work from home, employers are still responsible for their health and safety. They can trip and fall with a cord from their computer screen, and that can be a work comp claim. So employers do need to consider how are employees set up? Are they in a safe workplace in their homes? Timekeeping considerations become a really big deal if you have non-exempt or hourly employees, making sure that if they're working in little bits throughout the day, they really are recording and you are really actually paying them for all that time and overtime if need be. Expense reimbursement. This is talking about who's paying for what in the workplace. When I'm sending all my employees home, am I paying for their internet connection? Am I paying for their computers? Am I paying for special lighting, microphones for their Zoom calls? You know, what pieces am I, the employer, going to reimburse them for, pay directly or provide, and what pieces am I expecting the employee to cover? In general, I think it's a mix, and there are things we expect employees to have available or have ready at home. There's things the employer is going to need to provide as well. In addition, performance considerations, clearly stated performance expectations are so helpful in these situations. And if you're having performance issues, which this is a common area that I get questions and calls around, how do I handle this performance issue from a long distance, or when I'm not 100% sure what they are or aren't doing? But this is a thing definitely to sit down with managers and consider. Lay out specific expectations and guidelines. I expect you to answer calls within 24 hours or within 1 hour. Whatever your expectations are, just make sure they're laid out and agreed to and documented with the employee. Very important, working from home, keep in mind laws and tax laws where the employee works, because where they sit typically is going to dictate the laws that you as an employer now have to follow with that employee, and also the taxes, employment taxes you have or may have to pay, depending on if there's state reciprocity. Just for example, maybe you're a small business here in the Twin Cities, but now you have everyone working from home and you're not set up to provide work comp insurance or pay taxes or follow the laws for your employee that lives in Hudson, Wisconsin. So you have to consider that and get those things set up and in place so that your business is protected from violations of those kinds of things. And I highly recommend having some sort of agreement in place, a written telecommuting agreement with laying out all of these things and providing them all their legal notices for each state and their various locality policies. Lots to think about with remote and telework. And this is something, you know, there's kind of some standard agreements or templates that I have or I've worked with in the past that you can get from, you know, maybe other people you know in the workplace, or feel free to contact me. I'd be happy to try to provide something for you. A few extras. Back to your question, Chad, what if they refuse to work? If it's safety related, I think we've covered that. But keep in mind, if it's not because you have some kind of a safety violation in your workplace, they're just afraid to come to work, they kind of actually don't have the ability to refuse to come to work. At some point, you have the right then to replace them. And if they refuse to work when you're offering them a bona fide job, they may not qualify for unemployment. Keeping that in mind, do know that if they refuse to work and have an ADA, Americans with Disabilities Act need, they have a disability of some kind requiring accommodation, being out of work might be the accommodation you need to provide, at least for a short period of time, not indefinitely. So if they do have an underlying health issue, really ask about that, get doctor documentation and look into that situation. And then we've already talked about some of the OSHA regs and liability for safe work environment. Also, just super nice to know quick, if you now are in a situation where you need to have a salary reduction or layoff, just make sure you understand a salary reduction triggers in Minnesota the need for a new wage statement under the wage theft law. Don't forget to do that. It's easy to forget. Also, don't forget if you're doing a wage reduction, if they're salaried, you want to make sure they're still hitting that minimum FLSA, Fair Labor Standards Act, minimum salary per week. And also keep in mind, you're not required to provide them hazard pay. That was a really big thing at the beginning of the pandemic because there was a lot of fear and most people were afraid to come to work, or many were. And so hazard pay was offered, but it's not required. And it is an option if you're having trouble getting workers who that you really need who are afraid to come. Furlough of salaried employees, don't forget you have to pay them their full week for any week that they are working. And layoff termination is the only time you have to pay to the date of termination and pay out PTO and vacation. If you're furloughing, you can kind of hold off on some of those things and pay them out through the regular pay cycle as needed. And then quickly, if you're going to send someone home, they come to work and they seem sick, but they say, oh no, I'm not sick, it's just allergies. I've literally heard that so many times with so many clients. And Mike, I see you smiling because you've heard it too at your business. Oh, I'm not sick. But you have a right to send those employees home if you're concerned. This will not violate the Americans with Disabilities Act if you feel, they're a safety hazard in your workplace. I also highly recommend, this is a great policy to have in your handbook. I always write in contagious illness policies that will overtly be a guideline for your supervisors to follow in terms of when should I send someone home and how do I do it. So consider adding that to your handbook ongoing. But COVID-19 is not under the ADA a disability unless it causes extreme essential life function problems. If I'm no longer able to breathe, that's clearly a problem, and I'll need accommodation under the ADA. Any questions so far here, Chad? Okay. So I'd like to introduce Mike Schiebel, and Mike is an accountant and HR person. He has been doing those dual roles for many, many, many years. I met him in the early 2000s because we're a member of another HR organization called the St. Paul HR Association. And I wanted Mike to come in and speak today to give you a quick case study of how Deneen Pottery, also a Midway Chamber member, has been impacted by COVID, and it has significantly impacted their operations, their business decisions. And Mike, I'm really happy to have you with us. So why don't you tell us some of your story?
Sure, thanks. Yeah, so for us, we're a manufacturer of custom mugs. So thanks a lot, Chad. So we have to be here in the building to produce. A lot of people, when they're working from home, we didn't really have that option because only a handful of people really have office jobs. Otherwise, we're out in the plant. So I just wanted to share with you kind of like our story this year and what happened. This can take a few minutes. The last March, before Governor Walz issued the stay-at-home order, we had 91 employees and had a little over a 2-month backlog on orders. Things were looking pretty good for 2020. When the stay-at-home order was issued, we were deemed non-essential. We kind of mulled things over. We made the decision to furlough everyone at that time, except for a few people, mainly our 5 managers, to help figure out what are we going to do. I mean, at this time, we were really unsure what this environment was going to be and how long it was going to take. We received our PPP loan around the middle of the month, which allowed us to be a little bit more aggressive to figure out how we're going to get back to producing orders again. But we saw our backlog go from over 2 months to less than half a month's backlog, with a lot of customers calling to cancel or delaying some of their orders. So it made us very nervous bringing people back. During that April timeframe, we did use that time to kind of relook at our operations, see where it could be more efficient, see which people we could bring back, and really how we're going to get profitable. At this time, none of our employees or immediate family members had COVID. It's hard to even know somebody that was even close to having it. So it seems so far away that it was hard to be diligent, but we knew we had to be diligent to come back to work, to bring people back. So we really worked really hard to get these safety protocols in place, so we could do that. May 1st, when the governor lifted his order, we brought back a total of 48 employees. So it's less than half, or a little over half of our employees. It was not till mid-June where our orders started building up. And then by the end of August, we finally got back to our 2 months backlog. We continue to train our employees. It was super important for us to make sure that everybody was safe at our workplace and at home. Our building layout, some of you from the chamber have probably been in here, seen it. We're kind of a long building. It's hard to spread out because we have rooms and we had a lot of people in some of these rooms, so it's hard to do some of our operations. So getting back to 91 is gonna be really hard for us. In October though, we started adding back more employees because of our backlog. It was getting so big that we had to figure out a way to do it. At the end of October, we had a few employees test positive. And a few days later, some other people not feeling so well. But November 11th, we had 13 positive tests, and we decided to shut down on Wednesday, 11/11 through the weekend. So we paused for 4.5 days just to kind of see where things are at. We recommended that everybody go get tested. And the main reason that we decided to shut down, we actually had an employee come in and on Tuesday night called our HR and said, "Hey, I just received my positive test result." And we said to him, "Oh, we didn't realize you were getting tested." "Yeah, I haven't been feeling well and stuff the last couple of days." And in the department that he was in the next department that we passed things on, that's where the majority of our cases ended up being. So that was not great. It was not easy for our employees to get tested when we sent people out right at the beginning of November. Some of you have probably witnessed this as well. Everybody was starting to go get tested. It was super hard to get in there for a test. People were calling. It was 5-6 days before you could even get in for a test. If you walked up, sometimes you had a 3-4 hour wait, and some people walked right up. So it was really hard to do it. As employees tested positive or negative though, we allowed them to come back to work. In total, we had 21 cases out of our 65 employees that we had hired back. Test either because they were positive or they had a family member test positive. We looked at back in November, we lost roughly 1,700 hours of production time due to people being off during that. As of today, we have not had an employee test positive since November 15th. Our most seriously affected employee just came back last week on 12/8, 33 days after he tested positive. He was actually the only employee that we know that was hospitalized, and it was pretty serious. And he's doing great today. So we're happy to see him back. This last week though, was really our first normal week of operations since the end of October. Our orders have grown. We now have about a 4-month backlog. We're trying to figure out what best to do. We've added a second shift to try to spread people out as best we can. We continue to work on our safety protocols with our employees. Employee health is very important to us. There's a reason why we're not getting back to 91 employees, because we just don't think we could be safe doing that with our current environment. Obviously, this has put a large burden on our customers who've had to deal with a lot of long lead times and delays in orders. We recently sent an email out to 300 of our customers talking about the delays, and we only had a couple people really call in to cancel because we weren't happy with it. The majority of our customers wanted to be in the queue still, even though it was going to be delayed. At that point, we realized that we really have great customers produced by great employees that we have, and we're producing products that our customers love. We're doing everything we can to get back to full production, and it's just going to be a while for us, but it's been a struggle this year, just like many of you. That's it.
Thanks so much, Mike. Chad, are there any questions from the audience for Mike right now?
Well, I have a question, whether it's for Mike or maybe for you, Kara, but hearing Mike tell the story of an employee who was sick, let them know that he, after the fact that he'd gotten tested. This is a sensitive situation. I don't necessarily want to use the term repercussion, but you know, when you have an employee, if you have something in place, if you have a policy that's very clear, everybody has it, they know if I am feeling symptoms, I need to leave work. I can't stay there. I have to let them know. I have to get tested. But if somebody then doesn't do that, and then after the fact says, "Oh, by the way, I've been in the office, you know, at work for the last few days. I'm not feeling good. I haven't been feeling good. Now I got tested. I'm positive." I mean, the last thing you want to do is seem insensitive, I'm sure, and say, "Well, I'm sorry that you're not feeling well and you've got this horrible virus, but shame on you, and we're going to punish you." Like, what do you do?
Mike,
Yeah.
you go ahead with that
Yeah,
first.
can I answer that one? It's like, yeah, at first you are, you know, you're upset that it happened because of all the training we did and stuff and all the things that we did try to do. But for that person too, they misunderstood what the rules were because they were like, I thought it was this after I tested negative. And for us, we actually have a pretty, I don't know what cultural diverse group here. We have a lot of Hmong employees, and English is a second language, and sometimes they don't fully understand. And this one, this employee that happened to does speak English, but just kind of just misunderstood things. And it's hard not to get pissed at him, but really we ended up talking to him and stuff and just said, you know, what you did. And we told them the ramifications and stuff. They felt bad. They just weren't thinking. And that's where the thing is, I think what Kara said earlier, you have to keep training and retraining and stuff. You can't let up. I mean, we have something new coming out every 2 weeks in our company, and we're constantly being in front of things. We have things posted all over the place. You have to over communicate right now. This disease really comes in and can really affect your company fast, is what we found out.
Yeah, and I'll give just a really quick story for another client I work with in a small town in southern Minnesota. And they had a whole group of employees. I think it was 7. I could be wrong, could have been 9, but a big group of employees who all decided to attend a wedding together the end of October, or middle or end of October. And so, of course, what happened? They attended the wedding and it was indoors, and 2 people were sick pretty much right away. So maybe they had it prior to that going in, but those 2 people were sick and stayed home. So luckily they had the symptoms, they stayed home. But the remaining people didn't have any symptoms. They were at work for the next week and a half before they started developing symptoms. And so then they go get tested, but they have now well infected this workplace. And so it was a huge dilemma. Out of roughly 50 employees, at one point in early November, they had 12 people out with positive tests, and they had 13 or 14 people out awaiting their test results. They had so much, roughly half or more of their plant, already shut down, that because of the workflow, you can't keep operating. So they had to make the hard decision to completely shut down and do a huge deep clean of the whole plant as well as office areas. And then as they brought people back, as they were able to come back and reopen, they revisited all those COVID operating plans that they had done from the spring, all the safety and sanitizing training, all signed up for them. And the key there was also helping everyone understand the idea of exposure, because going to a wedding is putting yourself in, it was a very large wedding, apparently, I don't know the guest count, but it's putting yourself in the possibility of significant exposure and taking things really seriously. Again, when you have the sniffles, I think all of us at this point, we wake up in the morning, if you have a slight tickle in your throat, oh my gosh, am I sick? Do I have COVID? Should I stay home? Or should I push through my day like I probably normally would have? And half the time you're not going to have COVID, but right now, half the time you might. So you just have to be careful if you don't want to infect the entire business or affect the entire business.
The other thing that happened to us too, Chad, is we had a couple people when they went to get tested and they came back positive, they had no symptoms at all. So, they're what you call asymptomatic. So they're in here, they could be carriers. They're not feeling bad at all. Out of the 21 people, we know of 3 people. They said, yeah, I tested positive twice. They never got sick. They never felt sick. It's just really odd. So that's where it's that mystery thing. It's like you can do everything right and it can still get you. And that's where you just can't let your guard down.
Yeah, so we're specifically talking here about COVID, but it just makes me think about other times people get sick, with things that are less contagious. But what would the policy be if, somebody just is getting the seasonal flu some year and all of a sudden half the staff is down with the flu?
That's why you can definitely have a contagious illness policy in your handbook that kind of lays some of this out. And we have used this and at workplaces I've been in, when someone is coming to work really, really sick, they're sneezing and coughing all over. No one wants to be around that. And so we need the right and the ability to be clear and have a policy and send them home. They need to go home and get well. And in those cases, in the past, we've sometimes required them to come back with a doctor's note. That's a little tricky these days with COVID because they may have a hard time getting into their doctor. But that may be something you want to consider, that in order to come back, they need to come back cleared from their doctor or having quarantined or having a negative test result after 5 days. So let me move forward a little further and talk about something in the news right now. The vaccination is here. And I bet a few of you are thinking, should we require our employees to get vaccinated? And this can be quite a touchy subject, as I suppose some of you can imagine from news stories, because some people are very much against having vaccinations, unfortunately, because I think they're going to save a lot of lives and a lot of people, and have proven to over the years of various infectious diseases. So can you require it? Well, yes, no, and maybe. You may require it before they return to work. Maybe they've been out teleworking, but you really need to be clear that if this failure to vaccinate, will it constitute a direct threat? Is that why we're requiring this? Because you can say this virus is a direct threat to others, is a significant safety issue, because it is rampant, it is easily transmitted in the workplace. But you really need to be clear that's the rationale and the reason for doing it. And then on the no side, you're going to have your policies very clearly written for this that allow exceptions. The exceptions really need to be job related. You need to apply them consistently. There has to be business necessity in having the policy and allowing these exceptions for ADA disability concerns, people who can't get the vaccination because of, as we've heard in the news, those allergy concerns potentially or other reasons. And then under the civil rights laws, you have to also give exceptions to people with sincerely held religious beliefs. And I know for some people, they may just claim, I don't believe in it and it's my religion. So there's questions around that and how do you prove it? But in general, employers are going to be safer to just believe the people who have these beliefs of being exempted for religious reasons. You do not, as an employer, have to accommodate people's reasons about vaccines or beliefs about vaccines for secular or medical reasons. But again, on the medical side, there may be some ADA crossover you want to be a little bit careful of, work with HR about, or call an attorney. And by the way, the maybe comes in if you're unionized, you'll certainly have to address your collective bargaining obligations. May want to consider for the future, you have contracts that allow you emergency pandemic powers, so to speak, within your union contract. And hopefully your union will be flexible enough and want to also provide safety to the workplace that they're going to want to support all these types of rules and regulations you may want to put in. Businesses that can rely on remote workers may just find it easier to make it a personal choice policy, make it something you encourage. You may want to, just like in the past, we have flu clinics that come on site to the workplace. Maybe you'll want to, down the far road when it's widely available, have a COVID flu clinic on site to encourage people to get it done. But you may have some controversy if you decide to require for all employees. And then don't forget, there have to be a few exceptions.
Kara, would it be legal, ethical, or make sense for an employer to say, all right, I'm not going to require you to have the vaccine, but anybody who gets the vaccine and shows us that you did gets an extra day of PTO or some other incentive? Is that okay to do?
Oh my goodness, that's a good question. I hadn't given that one much thought. Technically PTO is discretionary. I mean, employers can give bonuses, can give out extra PTO if they choose to. So on one level, I think it's fine. I think this gets to something that coming up in one more slide or two about your culture and your values and what you want to promote. And, there may then be some hard feelings for people who can't get the vaccine.
Well, that's what I was
because-
wondering about. If somebody says, well, wait a minute, my religious belief says I should not be getting this. You're discriminating against me if they get PT and
Exactly.
I don't.
So you have to be careful from that respect. I have a feeling if you were to make it a small incentive, a token incentive, here's a donut or a bagel or a small gift card to Caribou, maybe that would be fine because people won't be as rubbed about it and it's giving people an attaboy or an incentive. But in that case then too, for people who have legitimate exceptions, I would give them the gift card or the bagel or the free cup of coffee as well, just to be safe on that respect. But I mean, this is something you could consider. It's similar to kind of a wellness program, and there are wellness incentives. So maybe work with your benefits broker, and benefits consultants to come up with something there. So businesses living with COVID, you have recruiting challenges. I know many of you are still in business and still operating and still trying to fill positions. As of the end of November, the unemployment rate across the US was 6.7%. So it's a little high, it's certainly, but it's not as high as it was. And finding qualified talent is still a problem in some skill areas. I am working with a number of employers having trouble recruiting, and you would think there's people out looking for jobs, but if they are, they don't have the right skills for these jobs I'm helping them recruit for. So try to reevaluate the qualifications and skills you need. Consider some of the nonprofits out there that are placing people with ready talent, particularly a group I have become aware of called Prosperity Ready, where they help to place college degreed immigrants. So they have college degrees and a lot of significant experience and training and may be ready for your workplace. Consider when you're living with COVID, we still aren't out of the woods yet. We're going to be living with it a while longer. Your company culture. Are we creating an us versus them kind of a setup in our culture that can be negative when we say, the plant, you all have to be working and potentially exposed to each other, but the office, you're all at home? Yes, you might. Is that okay? It depends. It might be okay for your culture. It might be understandable. It might be something you just need to address as a leader on a regular basis in terms of that over communication Mike was talking about, to help people understand the reality is the governor would like and has ordered most people to work from home if they can during certain periods of this outbreak, not the entire time. And that's just not possible for a lot of production operations. So I think people understand that, but as this goes on and on and on, watch out for the us versus them and find ways to make everyone feel appreciated, not left out for the people at home, but also not left out feeling at risk, the people in your plant. Make sure you go back to what your values are and display them. Make decisions based on what your values are, and be clear about those values. And that's how you're making decisions so people understand them. Also, consider part of your culture the ability to be really flexible these days and over communicate. I can't stress that enough, as Mike mentioned, on so many levels, and keep recommunicating and retraining, because again, it is human nature to cut corners on all those great sanitizing procedures we have. Also consider work-life balance right now with people and the distractions they have, maybe the childcare disruptions they have when their daycare closes and now the parent or someone needs to stay home with those children for a quarantine period. The online schooling is a huge distraction and disruption for some people, and it's difficult depending on age and who can handle it themselves or not. Other ill family members you're caring for, and keep in mind performance expectations and performance reviews for this year need to adjust. We can't be held to the same high, strict standards maybe we have in the past. We're going to have to give and have some flexibility because it's probably in our culture and just required right now in our performance reviews and goal setting going forward. And then you have to consider compensation in terms of, is there hazard pay, so to speak, for certain positions? Should I change their pay if now they're working from home and pay in that part of the country is different than in this part of the country, et cetera? I mean, there's a number of different, we could have a whole session on comps, so I won't spend a lot of time on that one.
Kara, I don't know if you want to go over this now or maybe later, but I'm curious what we've been doing during the COVID time that you think is going to stay. You know, you're talking about these adjustments that we're making and how employers seem to be a lot more understanding of employee needs on if you feel like you're sick, you got to go home, or hey, my daycare called, I need to go and get my kid because he's not feeling well at school. Um, are we going to be more understanding of those things going forward? What other trends do you think are going to stay with us?
More businesses will be more understanding and provide some new creative ways to be flexible. I think with families, with parents, it's not always because of childcare. It could be because of elder care needs as well, or just people's own illnesses. We've proven now telework can work. We've also proven in some cases it doesn't work very well. So now we have data and the ability to be clear about what works, what doesn't. But I think there will be a lot more telework or a lot more flexibility to have that at different times. That will definitely be one key adjustment to the workplace. And if I can, my next slide and almost final slide here, I think I'm going to talk about new work competencies we need. But really quickly, for employees who aren't following your safety rules, these cleaning, sanitizing rules, they are coming to work sick. What can you do about that? Well, if it's a straight up, OSHA safety rule that they're not following, if they don't follow lockout tagout, we write them up. We take those very, very seriously because of the hazard. I think if it's a straight up safety issue that you're experiencing, you can go ahead and discipline and write that person up, particularly if they've been trained and you have policies in place. But what if it's just they just didn't respect the rules and they went to the wedding and got exposed to a whole ton of people and came to work and didn't tell anyone and on and on. That's a little harder to deal with, but I think it's worth a conversation. You can definitely sit down with that employee, and in the context of reviewing your policies and what you expect them to communicate and provide, you review all of that and let them know that what they did may have put a lot of people at risk. Again, so that training and retraining is so critical. And then using progressive discipline where need be. But again, when it's a straight up OSHA violation, we typically go straight to serious consequences. So there may be times that's appropriate for violating any of your COVID related safety rules. I also think work from a long-term perspective, Chad, some workplaces are going to definitely restructure, provide more part-time opportunities for people, more job sharing opportunities. We have to get good at restructuring how we might measure our work and performance. And there is and probably will be more new automation coming to help minimize some of the things we have to do interacting with people or in groups. And then maybe we just have to think about, is there some work we could stop doing? We thought we needed X and Y done in our workplace, and now that it's not getting done because people are at home, maybe we don't even miss it, and we should really get rid of that. That's certainly a key, feature of lean and a lot of quality systems. And lastly is the new work competencies of adaptability. We need that in our people. How do we train and hire for that? Dealing with ambiguity, certainly, particularly at the higher management levels, trying to understand where our businesses are going and how to make decisions. Problem solving, how are we going to get through this? How are we going to make it work in a plant like a pottery shop and that people sit close together? And there's a lot of problem solving and learning on the fly going on there, dealing with paradox, having a lot of patience and taking perspective on everything that's going on and looking at what's important. So all of those new work competencies, I think, are here and are coming. And I would love more questions or specifically to hear from anyone on this call, what is your input in terms of what's your biggest change in living with COVID at your business or biggest challenge in living with COVID at your business?
Great. Well, we can open it up. If people feel more comfortable putting it in the chat, they can. But if they have a question and they just want to ask it, feel free to unmute yourself and do that as well. So do we have any questions people want to ask or comments that they want to make about what they've been doing in their office? There's a question here from Dustin. Has there been any guidance on what happens for folks who are currently utilizing the EFMLEA and the end of leave, and the end of the leave is after 12/31/2020?
Right. So I wouldn't say there's any guidance at the moment. I would have to say that once 12/31/2020 comes, you no longer have to provide that leave. Certainly, you're not going to be eligible for a tax credit for any pay that is paid out on 1/1 unless the government re-ups this program. Does that mean you shouldn't maybe give them the time off? I would highly recommend. We still need people to take the time away from work. That's why this was put into place in large measure, is to give people that cushion and ability to say, if I come forward and say I'm sick, I can go home and be paid and not worry about my job or worry about my paycheck for a short period, at least the 80 hours in most cases. So consider offering it on your own if possible, because I think it's still a really good program and a good thing to encourage employees to take care of themselves and not expose others. But yeah, you won't get a tax credit on 1/1 as of today, as of this moment. More to come, I hope, on that.
Great. Any other questions?
Or challenges when living with
Yes, or
COVID.
challenges. Murray, you're back. Do you have a question?
Well, I just want to make sure everybody understands, I won't be coming into your house this year. Your stuff will be outside.
Or down the chimney.
Right.
Thank you, Santa. I'm glad you hopefully are staying safe and keeping all those reindeer healthy too.
I'm going to go get a hot toddy.
Excellent. That
Must
sounds
be 5 o'clock at the North Pole. Okay.
Mike and Kara, wonderful job.
Yes. Thank you, Kara. Thank you, Mike. Well, that concludes our program. This is going to be available on a recording, and Kara is going to send over the PowerPoint to me. So we'll make sure that we include that in our email out to everybody. And again, hope you can join us for our next 2 events we have this week, the last 2 of 2020. We've got our fiscal sponsorship meeting for Celebration Nonprofits tomorrow at 8 a.m. And then we have our holiday virtual party Thursday at 4 o'clock. Thank you so much and have a good day, everybody.
Thanks.
Thank you. Bye.